Mental health issues in the workplace are on the increase. Throughout the last 100 years, although effective treatment for physical health has increased at an exponential rate, and incidences of cancer and heart disease are falling dramatically, mental illness has increased. As stresses and strains of modern living take hold, we find some staggering statistics within the working environment. With 1 in 5 people suffering from some form of mental illness in the workplace at any one time. Less than half the people diagnosed with mental health problems have told their line manager. Poor mental health costs UK employers alone £33 to £42 billion each year. And depression will become the leading global illness by 2030 according to the World Health Organization. Forward-thinking employers support employees who are experiencing mental health problems to help them cope, to recover more quickly and to be more productive. But the type and quality of the support employees receive is absolutely key in determining how quickly they are able to bounce back to performing their roles effectively. Standing by employees when they experience a mental health problem sends a very clear message about your company's values, and organisations that support staff reap the benefits through loyalty and commitment from everyone. We've all had mental health issues from time to time and can be affected by a range of factors both inside and outside of work. But in the same way that if we fall ill physically, we should rest and recuperate, if we fall ill mentally, we should be doing exactly the same. To treat mental health in the same way as physical health, with no stigma attached, is called a parity of esteem. For this to happen effectively though, it's vital that organisations have clear, well-publicised channels in place for employees to raise concerns, and the company has the necessary values and behaviours which help create the right culture and space for employees to be open and to seek support and to take positive action promptly. Simple things such as one-to-one meetings and catch-ups are a great place to ask your team how they're getting on, and doing this regularly will help build trust and give employees a chance to raise problems at an early stage. Having a management style which is based on common sense, empathy, being approachable and properly listening will help to create the right environment. It's so simple to just ask someone how they're really doing, and it's important to create this environment where people can be open. Some signs to look out for as a manager are a change in people's behaviour and mood and how they interact with their colleagues, changes in their work output, motivation levels and focus. If they're struggling to make decisions, get organised or find solutions to problems. If they appear tired, anxious or withdrawn and lose interest in activities and tasks they previously enjoyed. Or if there are changes in eating habits, appetite and increased smoking and drinking. If you suspect someone is struggling with their mental health, find an appropriate place to sit down with them and encourage them to talk using open and simple, non-judgmental questions, ensuring complete confidentiality. Listen to them carefully and don't make any assumptions. Offer support and reassurance, and only when they have completely finished telling you about their situation, come up with any suggestions for an action plan, which could incorporate ways to deal with perceived stress triggers and crisis management, and any further appropriate professional support. Focus on what you can do together rather than what you cannot do. There are plenty of changes to how people can perform their role to fit into an action plan to deal with mental health issues. Changes in workspace environments such as a quiet or naturally lit space, changes to their job description and duties or redeployment to a more suitable role, and of course suggested training and support in ways of dealing with mental health. Once aware of this information, employers have a legal duty to consider making reasonable adjustments, and they also have a general duty of care and responsibility for employee health and preventing personal injury. You want to provide a supportive, empowered environment, but be careful not to overdo anything, as self-esteem and anxiety issues can be exacerbated when people feel their abilities aren't being trusted, or they experience prejudice or discrimination, and are not fully appreciated for the contribution they are making. Also, bear in mind that you should continue to give employees work which is challenging and engaging. Dealing with long-term absence can also be an issue, so be proactive and get involved as early as possible. Maintain contact with them throughout and be sensitive to the individual's needs, whilst being positive, professional and supportive. Developing a mental health strategy in your workplace is essential to avoid hefty costs further down the line, so ensuring you have the right policy and procedures in place is key. Getting buy-in from senior management is essential, and raising awareness and ensuring your managers have the right skills to carry out the policy effectively is vital. This is where Rethinking Business can help you. If you would like professional assistance setting up a workplace mental health policy, then please contact me directly for more information. Thank you for taking the time to watch this short video.